Okay, hi everyone. So we're gonna kind of talk about some methods to use while you have braces. So good techniques to use. One that you can use to help floss is called the platypus. So this item is the platypus because usually it's like a floss threader, but instead of having a thick end on this end, it's more so thin on this one. So it's easier to go underneath the bracket. So for example, this is acting as our bracket, and usually you can't go down like this because it gets stuck, but with the platypus now you can just kind of twist it backwards, so then the thin part is going underneath the bracket, so then you're getting through. So just like you can kind of see, it's getting in between the teeth like this, and it can slide in between. Since this end is thick, it's not able to go past the bracket, but this end is thin, so it can. And then something else that's cool, and it also saves quite a bit of time, because a lot of times teenagers don't like to floss very much, and so this saves a lot of time and it's easier. And they've got this other end that is also helpful when trying to get things out, so they can like go interproximally or even just underneath it, kind of just getting it all out. So this is the platypus.
Okay, and then there's another method you can use it too, which is called the floss threader. So it kind of looks like this, has a really thin end, and it has a little hook at the top of it. And then what you're gonna do with this, you're going to grab your floss, and it has to be the string floss, and then you're gonna basically just feed it through the hoop, and you're gonna pull it like this, basically if you're going to like sew something. And then what this does is helps the patient go underneath their wire and then pull it through so they can floss. So I'm gonna turn it just this way, and then I'm gonna go right under here, and I'm gonna pull this through. And then whenever you're out here, what you're gonna do is you're just gonna keep one of the strings down, and you're gonna pull the other one through. And then this helps the patient go in between the teeth so they can floss and get all the food out of there. And this is working as a wire right here, and they're able to floss. And because they can pull it back up, you will advise your patient to just pull it through whenever they're done, and they're gonna repeat this motion for every single tooth. And that is what the floss threader does.
Yes, so those are the two techniques that are very helpful with orthodontic patients. Something else, while they're brushing, we do recommend using the phones method. So with the phones method, what is typical is it's not there's no certain like degree of angle to brush with it. It's mostly just a circular motion, and usually you can get 4 to 5 teeth within this like range of motion. So you just go in a circular kind of area just like that, and trying to scrub get in all the teeth around that. So that is usually what the phones method is used for. We also want to advise our patients while using this method, and any method anyway, is to not brush super hard, because if we brush really hard, then the bristles can get like bent, and then we're just brushing with like the plastic inside. So we want to be very light and very gentle with it, and just do a circular motion and be very like light, so then the bristles can stand up and get in between the teeth and interproximally. So phones method, circular motion.
The phones method is directed to mainly teenagers because they have already a hard time brushing. So doing the circular motion, like Eden said, and getting all those teeth, it's very recommended for them, but also for patients that have braces as well, where they can kind of do the circular motion to get any food that could be stuck underneath the wire. They can also put their toothbrush in a 45 angle degree and massage their teeth like that as well, to brush any food particles that might be in there as well.
And then something else that is good, not everybody has braces, but a lot of people, if they go through that orthodontic treatment, have that bottom wire retainer on the bottom or even on the top. And so these appliances are very helpful in that regard as well. I would say the flosser is a lot more, I don't know, it's just a lot better in that case, because it can get underneath the gums and go into the gums, whereas the platypus, even though it's thin, it's not as thin to get right beneath the gums. So what you want to do is just go in between the areas that have the little retainer and can pull it through, and that helps with not having calculus build up and removing plaque and tartar that is underneath there as well. So that is also an appliance to use.
Yeah.
But yeah, other than that,
That's the bones.
Thanks for watching.